The topic we're going to discuss today is the most important topic which we encounter in our general OPDs and surgical theaters as well. So the topic is cholecystectomy for cholelithiasis. There are some other indications for cholecystectomy, but the most important indication and the most common indication for cholecystectomy is cholelithiasis. So let's start and kill the topic today. To know about a cholelithiasis and their formation, you should have a little bit of idea what is actually a cholelithiasis. And the most important thing is to know is about the surgical anatomy. So we will be discussing in a couple of minutes. Okay, so cholelithiasis mean these stones in the gallbladder, okay? So it can be the cholesterol stones, it can be pigment stones, or they can be mixed stones. But most commonly, they are if we talk about the US, and the European population in the UK, the most important cause for the development of this stone is the cholesterol. In almost 80% of the cases, they are the cholesterol stones. But if you talk about the Asian population, so the most common cause for the Asian population is the pigment stones. When we'll be discussing about the stones and their morphology and their presentation, then I'll be telling you in detail about the formation. But this is the most common surgical presentation, and it can be emergency or it can be a simple biliary colic, and we'll be discussing how this actually stones can present to you, like in the form of a biliary colic, or they can be asymptomatic, that there can be acute cholecystitis, there can be chronic cholecystitis, there can be mucocele, or there can be empyema of the gallbladder. So to know about these details, let's have a little bit idea about the surgical anatomy, and then after discussing about the surgical anatomy, we will be moving on towards the development of the stones and their appropriate treatment.